What is the most appropriate action when a patient refuses to take a prescribed medication? A. Insist they take it immediately. B. Mix it into their food without telling them. C. Document the refusal and notify your supervisor. D. Throw the medication away. Answer: C. A patient has the right to refuse care. The HHA must document the refusal and report it to the supervisor or nurse. When providing perineal care to a female patient, you should clean: A. From back to front. B. In a circular motion. C. From front to back. D. Only when she requests it. Answer: C. Always clean from front to back to prevent the spread of bacteria and reduce the risk of urinary tract infections. A patient with dysphagia is at increased risk of: A. Constipation. B. Dehydration. C. Aspiration. D. Vomiting. Answer: C. Dysphagia, or difficulty swallowing, can lead to aspiration, where food or liquids enter the lungs. The most effective way to prevent the spread of infection is: A. Wearing gloves at all times. B. Using antiseptic wipes. C. Proper hand washing. D. Wearing a face mask. Answer: C. Hand washing is the most effective method for preventing the spread of infection in healthcare. When assisting with ambulation using a gait belt, you should place yourself: A. Behind the patient. B. To the patient's weaker side. C. To the patient's stronger side. D. Directly in front of the patient. Answer: B. Standing on the patient's weaker side allows you to offer the most support during movement. If a patient begins to fall while walking, the best action is to: A. Catch them in your arms. B. Yell for help. C. Ease them to the floor. D. Try to carry them to the nearest chair. Answer: C. Support the fall and lower the patient gently to prevent injury to both patient and aide. The purpose of a care plan is to: A. Track billing. B. Guide patient treatment and services. C. Monitor staff performance. D. Record insurance information. Answer: B. A care plan outlines the specific needs of the patient and the tasks the HHA is authorized to perform. Which of the following is a sign of elder abuse? A. Improved appetite. B. Increased social interaction. C. Unexplained bruises. D. Increased energy. Answer: C. Unexplained injuries may be signs of physical abuse and must be reported immediately. When helping a patient use a bedpan, it is important to: A. Leave the room for privacy. B. Place the bed in Trendelenburg position. C. Keep the head of the bed elevated. D. Use cold water for cleaning. Answer: C. Elevating the head helps with proper elimination and comfort. HIPAA regulations primarily protect: A. The patient's home safety. B. The employee's wages. C. Patient privacy and health information. D. The facility's policies. Answer: C. HIPAA protects the confidentiality of patient medical records and personal health information. Before taking a patient's radial pulse, you should: A. Warm your hands. B. Wash your hands. C. Take a blood pressure reading. D. Record their respiratory rate. Answer: B. Hand hygiene is essential to prevent the spread of infection before any patient contact. When repositioning a bedbound patient, how often should you do it to prevent pressure ulcers? A. Every 6 hours. B. Every 2 hours. C. Once daily. D. Only if they complain of pain. Answer B. Repositioning at least every 2 hours helps prevent pressure sores and promotes circulation. Which of the following is a symptom of low blood sugar, hypoglycemia? A. Increased thirst. B. Flushed skin. C. Confusion and shakiness. D. High fever. Answer C. Hypoglycemia causes symptoms like dizziness, confusion, and trembling. A patient complains of chest pain. Your first action should be to A. Offer water. B. Call the family. C. Notify the nurse or supervisor immediately. D. Tell the patient to rest. Answer C. Chest pain may indicate a serious cardiac issue and must be reported immediately. What is the best way to communicate with a hearing-impaired patient? A. Shout loudly. B. Face the patient and speak clearly. C. Use hand signals only. D. Talk to their family instead. Answer B. Facing the patient allows them to read lips and better understand your words. A home health aide is allowed to A. Change sterile dressings. B. Give medications without training. C. Help patients with ADLs. D. Diagnose conditions. Answer C. HHAs assist with activities of daily living, ADLs, but do not perform clinical procedures. If a patient has a Foley catheter, you should A. Hang the bag above bladder level. B. Empty it once a week. C. Ensure the tubing is not kinked. D. Pull it out if it leaks. Answer C. Kinks in catheter tubing can block urine flow and cause discomfort or infection. Proper body mechanics include A. Twisting your back while lifting. B. Bending at the waist. C. Keeping your back straight and bending your knees. D. Lifting with your arms only. Answer C. Bending at the knees and keeping your back straight reduces injury risk. A partial bed bath includes cleaning the A. Entire body. B. Only the feet. C. Face, hands, underarms, back, and perineal area. D. Just the legs and feet. Answer C. A partial bath focuses on key areas where sweat and bacteria accumulate. Gloves should be worn when A. Feeding a patient. B. Making an unoccupied bed. C. Changing a soiled brief. D. Giving a back massage. Answer C. Gloves protect both the patient and caregiver from infection when handling bodily fluids. A patient who is NPO should not be given A. Warm soup. B. Ice chips. C. Water. D. Anything by mouth. Answer D. NPO means nothing by mouth, including liquids, due to medical instructions. When documenting patient care, you should A. Write after your shift ends. B. Use a pencil. C. Be accurate and factual. D. Record only abnormal findings. Answer C. Documentation must be timely, accurate, and objective. The Heimlich maneuver is used to A. Start CPR. B. Treat burns. C. Clear a blocked airway. D. Reduce fever. Answer C. The Heimlich maneuver is a first aid technique to relieve choking. A patient with left-sided weakness should be assisted by A. Standing on the left side. B. Standing behind them. C. Standing on the right side. D. Not assisting at all. Answer A. Support should be given on the weaker side to prevent falls and provide stability. If a patient's family offers you a tip for good care, you should A. Accept it with thanks. B. Report it to your supervisor. C. Use it for transportation. D. Deposit it in a patient fund. Answer B. Accepting money from patients or their families is generally against policy and should be reported. A patient who is incontinent may need A. Tube feeding. B. Constant oxygen. C. Protective briefs or pads. D. More vitamins. Answer C. Incontinence supplies help manage hygiene and comfort. Which diet would be appropriate for a patient with high blood pressure? A. High sodium. B. Low fiber. C. Low sodium. D. High fat. Answer C. A low-sodium diet helps manage hypertension. What is the first step in any emergency situation? A. Provide CPR. B. Move the patient. C. Assess the scene for safety. D. Call the family. Answer C. Safety of the caregiver and patient must be ensured before taking action. Which of the following must be reported immediately to a supervisor? A. Patient requests a blanket. B. Skin is cool and dry. C. Blood in urine. D. Low appetite. Answer C. Blood in urine can indicate a serious medical issue and must be reported right away. When should a home health aide check the patient's environment for safety hazards? A. Once a month. B. Only during storms. C. On each visit. D. Only after an incident. Answer C. Frequent checks help prevent accidents and ensure a safe care environment. If you find a medication bottle on the floor, you should A. Give the medication to the patient. B. Dispose of it. C. Report and return it to the supervisor or nurse. D. Ignore it. Answer C. Medications must be handled carefully, and any issue must be reported. How should you clean a patient's dentures? A. In cold water with a toothbrush. B. Using bleach. C. With warm water and a denture brush. D. Soak them in alcohol. Answer C. Use warm water and a special brush to avoid damage. The most important reason for bathing a patient regularly is to A. Help them sleep. B. Keep them smelling good. C. Prevent infection and promote hygiene. D. Make them feel pampered. Answer C. Bathing promotes cleanliness and helps reduce infection risk. If a patient's care plan states they need a mechanical lift for transfers, you should A. Ask a family member to help. B. Try to transfer them manually. C. Use the lift as directed. D. Avoid the transfer. Answer C. Always follow the care plan to ensure patient safety. To encourage a patient's independence, the HHA should A. Do everything for the patient. B. Allow the patient to complete tasks they're able to. C. Ignore patient requests. D. Let family decide what's best. Answer B. Promoting independence helps maintain the patient's dignity and physical abilities.